Welcome to the Westchester County Association's Fall All Access Healthcare Forum. Thanks for agreeing to spend the next hour or so with us. I'm Michael Ramita, the President and CEO of the Westchester County Association. We are the region's professional roundtable. We work collaboratively with businesses, nonprofits, government representatives, and our elected officials to foster a strong economic environment to help our businesses grow and thrive, but also to improve our community for those who live and work here. To learn more about our work, you can find us at www.westchester.org. Now, healthcare has always been a strong focus of the WCA. And information on the state of the virus, the vaccines, mask mandates, and what that means for your businesses and for your kids is in a constant state of flux. In fact, there are new developments just this morning, and we thought you might have some questions. We're hoping to provide some answers. Before turning some things over to Amy Allen, our Vice President and resident expert on all things healthcare, a special thanks to our event sponsors, Health eConnections, and I know we're joined today by Christina Carroll and Diane Bettini, who've zoomed in to join us, and C-Clean. And Joe Pizzamenti has also joined in this afternoon to watch. Also, a special thanks to our Platinum Healthcare sponsors. Now I'm going to turn things over to Amy Allen to introduce our moderator and today's panelists. Thank you all for tuning in.
Thank you, Michael, and thank you everybody for tuning in. As Michael mentioned, this is one of our all access healthcare programs, and these programs are designed to bring together subject matter experts on timely healthcare topics that are important not only to healthcare providers, but to the community at large, and particularly the business community. And today's program is no exception, as we will be addressing how all of the current COVID-19 information should inform employers' back to work decisions. Variants, vaccines, booster shots, long haulers, mandates. How do we sort through it all? And as Michael referenced, these things are changing daily, if not hourly. Fortunately, we have a panel of experts who are going to help us do exactly that. Before we get started, just one housekeeping note. We encourage questions from our audience, and we ask that if you do have any, please post them in the Q&A box on your screen, not in the chat box, and we will get to as many as time permits. And also, this program will be recorded and available on demand. It is now my pleasure to introduce Dr. Sherlita Amler, Health Commissioner of Westchester County, a role she has held since 2011. Dr. Amler is a licensed physician, a registered nurse, and a certified emergency manager with many years of public health experience at the federal, state, and local levels. She has led Westchester's public health response to the COVID-19 pandemic since March 3rd, 2020, when some of the first cases were reported in New York. Dr. Amler, we look forward to hearing about all things COVID related. Thank you.
Thank you. So good afternoon, and I think they're going to be pulling up my slides and we will begin. And I just want to thank you all for joining us as we discuss the COVID-19 impact and how our past experiences with this virus will inform our decisions moving forward. My first slide is from the CDC, and it provides a visual of the reported COVID cases in the United States beginning in March of 2020. Here in Westchester, you may all remember that we had our first case reported on March 3rd of 2020 in New Rochelle, and that's a day that I will certainly never forget. So on your far left of this screen, you can see March of 2020, and we see the number of cases increasing in a slight wave in the summer. And then as the outside temperatures began to drop, along with the holidays occurring, such as Halloween. Halloween was a Saturday that year. And I know that here in Westchester, there were many parties that occurred that night, and there was a dramatic spike in the number of COVID positive cases, both in Westchester and in the United States following Halloween, also Thanksgiving and Christmas. So here in Westchester, if we looked at our numbers on October 25th of 2020, we had 71 new positive COVID cases that day and 6 new hospitalizations. Our numbers continue to climb through Thanksgiving and Christmas and New Year's Day. And our new case count for that day, New Year's Day, that single day, was 1,019 cases with 47 hospitalizations. So what stopped this spike? I think the answer was in part that in beginning December 14th of 2020, COVID vaccines became available here, starting with our healthcare provider community. So we see a sharp decline in February of 2021, followed by a slight bump in March, which may have in part been due to the presence of the UK variant B.1.1.7 becoming the dominant COVID strain in the United States. This strain, as we all remember, was much more contagious and was being spread largely among young unvaccinated people. In August of 2021, Pfizer's emergency use authorization was extended down to 12 years of age. And so this group was then available to be vaccinated. Our numbers continued to improve through the summer of that year until July, when the Delta variant became the dominant strain in the United States. The good news was that our vaccines remained highly effective against preventing serious disease, hospitalizations, and death. And we have continued to move forward in our efforts to vaccinate everyone who's eligible. And with every day, we add more people to the pool of those who are fully vaccinated and hopefully are protected against COVID-19. Next slide. This next slide, also from CDC, demonstrates the COVID reported death rates by age. And we can see the large purple, the spiky purple lines are actually individuals who are more than 75 years of age. And we can see that there were 2 large spikes in deaths that started in April of 2020 and a second large spike in October of 2020. And these were, as I said, primarily in the 75 plus population. The decline that occurred in the second spike, as you can see, that was in January and going into February, actually coincided with the widespread vaccination of our older population, which was the first group of the public that was vaccinated outside of the healthcare providers. And then you can see, looking at this, that with decreasing age, the number of COVID deaths declines to the dotted green line at the very bottom, which is individuals 0 to 4 years of age. And you can see there were relatively few deaths in that population. Next slide. My third slide, which is also from information from the CDC, shows data from several studies that indicate that vaccination was 94% effective in preventing hospitalization in seniors over 65. So you can see the blue rate, the blue line that has the spike at the very end, that is unvaccinated persons. And the green line at the bottom represents vaccinated individuals over 65 years of age. And this graph just really truly demonstrates what we're trying to accomplish. We can see that unvaccinated older people really end up in the hospital much more often than vaccinated older people. And what we really want to prevent, of course, is hospitalization and death. That's the reason that we vaccinate. Next slide. So here I've added a few slides on the various vaccines available for COVID, but I'm not going to spend a lot of time with these, as we have panelists that I expect that will cover this information in much more detail. But the bottom line is that we have 3 vaccines available to prevent COVID that are available every day, many places, to the public. Pfizer now has full FDA approval for the 17 above age bracket, and the remaining vaccines are provided under emergency use authorization from the FDA. Next slide. So a third dose is also available for Pfizer and Moderna for incompetent or immunocompromised persons. And we call it a third dose because it means that the first 2 doses that they got, they did not achieve full immunity. And so this is considered different from a booster. And so people get these terminologies often confused. But a third dose is really restricted to people who are immunocompromised for whatever the reason. And you can see there are a number of reasons that can cause this to be the case. Next slide. So recently we have added vaccine boosters for all 3 vaccines for those over 65 years of age or individuals with certain underlying medical conditions or those who work in an environment that proves to be a high risk for exposure. In addition, the FDA recently approved the EUA for Pfizer for the 5 to 12-year-olds population, and the ACIP, or the CDC's Advisory Committee on Immunization Practices, will be meeting next week to discuss this, and we hope at that time they will vote for a final approval for the EUA on this population. Once approved, we hope that parents will get their younger children vaccinated. Beyond the protection that these vaccines will provide against COVID, I think one of the major benefits to many families is that fully vaccinated children do not have to quarantine when they are exposed to a case of COVID, which will help keep these children in the classroom and out of quarantine status at home, which I know will make a lot of parents very happy. Next slide. This slide shows our local data here in Westchester from November 20, some from 2020, and our current data. And just as an example, our numbers from November 25th of 2020, nearly a year ago, 11 months ago, the new case count for that day was 477 people, meaning that 477 new cases of COVID were identified that day. Our new hospitalizations for that day were 23, meaning 23 new people were admitted to the hospital, and there were 4 deaths. Our numbers for Monday of this week, so we're comparing that November 25th to October 25th of 2021. This week on Monday, there were 49 new cases identified of COVID. We have been averaging somewhere around 100, but that on Monday they were significantly down. And we had 9 new, so we had 49 new cases. We had 2 new hospitalizations and unfortunately two deaths on Monday. So what is the difference between these years? Well, the answer really is the vaccination of a large percentage of our population. In Westchester, as you can see, the percentage of people with at least 1 dose of vaccine greater than 12 years of age is 90.6%, almost 91%. I think that is really, it's remarkable. And for those over 65 years of age, the percentage with at least 1 dose is 99.7%. So nearly 100% of people who are over 65 years of age have 1 dose in this county. For those who are fully vaccinated over 12 years of age, the percentage is 81.3%. And for those over 65 with 2 doses, which we would consider fully vaccinated, it's 85.8%. These are really impressive numbers. And I hope that we're going to do equally well with the 5 to 12-year-olds when the Pfizer vaccine is approved for us, hopefully next week. So no one can totally predict the future of COVID. There's always the chance for new and more dangerous variants to arise. But the higher the vaccination rates are in our population and in the world, the less the risk that that will happen. And so hopefully the sooner everyone gets vaccinated, that it will be safer for everyone to return to school and to work. So I would encourage you all to get vaccinated if you aren't. If you have family members who aren't vaccinated, to encourage them to be vaccinated, because I do think vaccinations are how we one day put a close to the chapter that is called COVID. Thank you.
Thank you, Dr. Amler. We are clearly very fortunate to have you at the healthcare helm in our county. And thank you for agreeing to join our other panelists for the ensuing discussion. I would now like to introduce our panel moderator, another Dr. Amler, namely Dr. Rob Amler. This Dr. Amler is Vice President for Government Affairs at New York Medical College and Dean of the School of Health Sciences and Practice and Institute of Public Health. He has helped pave the way for major groundbreaking initiatives, including the NISTAR Center for Disaster Medicine, which is actively focused on the response to COVID-19. And previously, Dr. Amler was, among other roles, a Chief Medical Officer at the CDC. Dr. Amler will set the stage for today's discussion, introduce our distinguished speakers, and moderate the panel discussion. Thank you, Dr. Amler.
Well, thank you for the very kind introduction and for inviting this panel to come forward on behalf of the Westchester County Association, which has for many, many years focused on healthcare, access, quality care, and all of the things that we care deeply about. So thank you on behalf of myself and the audience today. So speaking directly to you and our audience, let's face it, we have heard a lot about COVID. We've heard more about COVID than we wish we had, right? This has gone on for a long time. And let's face it, we are all sick and tired of this virus. The problem is the virus is not tired of making us sick, of disrupting our daily lives and our economy. We'll be turning for some answers. When will this end? What do we do now until it does end? Because we have to figure out how to hasten the day when we can move on and get back to what we would consider normal life again. For answers to these other questions, we now turn to our panelists and to our keynote speaker, who will hopefully enlighten us with at least as much as they know up to this point. Let's remember one of the first comments made by our keynote addresser was that we're still learning about this awful virus and still learning how to make it retreat and finally get conquered by the technology and the other interventions that we have. Starting with Dr. Rafael Torres from White Plains Hospital. Dr. Torres was named their first Chief Quality Officer almost a year ago. He's had a career-long focus on quality improvement and leadership in emergency medicine. He's practiced emergency medicine for almost 20 years, 16 of which have been in leadership roles in emergency departments in the Bronx and Westchester. He served as Director of Emergency Medicine at White Plains Hospital, and in the past year, he led the hospital's COVID response and testing program, and he spearheaded their vaccination program that reached more than 22,000 community members across Westchester County. Interestingly, he's also a graduate of Intermountain Healthcare's Institute. That's a great name out in the Rocky Mountains for those of us who have practiced out there. He was in their healthcare delivery research clinical quality fellowship program, and he is also completing a healthcare executive M.B.A. with a graduate certificate in healthcare quality from his old alma mater, George Washington University, in that great nation's capital to our south, Washington, D.C. He's also an undergrad graduate of Johns Hopkins, and it's really a pleasure to have him on board. I'll introduce our second panelist when he's finished with his introductory remarks. Dr. Torres.
Thank you, Dr. Amler, for that kind introduction. Appreciate it. I have a really unique perspective, as you alluded to in those opening remarks. I was in my 6th year of leading our emergency department when COVID struck on March the 3rd of 2020. And my responsibility then was to keep our staff safe as well as our patients safe. And it was a very trying time, as you can imagine, but we did it quite successfully, having discharged more than 3,000 patients with COVID-19 from our organization, and treating many, many others. And as time went on and the vaccine presented itself, I was responsible for, in my new role as the Chief Quality Officer, overseeing our COVID vaccination program. And like you had said, also, we used over 23,000 vaccines over the past 11 months or so. And very successful program. We were working directly with the governor's office and went out to houses of worship, the Yonkers Raceway, Westchester County Airport, deep into the community in Mamaroneck and New Rochelle to try to get vaccines in arms. So I'm really happy to be here today. I'm happy to answer any questions that you have. I want us to get back to normal. I want our families to be safe and healthy, and vaccination is the way to do that. So thank you all for being here, and I'm looking forward to the questions.
Thank you. And you said it so well, Dr. Torres. Staff safe, patient safe. That is what it's all about when you're trying to run a first-class hospital like White Plains Hospital. So thanks for those comments. We'll get back to you with some of the Q&As. Our other panelist is Dr. Sharon Bushi from Montefiore Department of Rehabilitation Medicine, but also from right here in Westchester, the Burke Rehabilitation Hospital, where she is an attending physician in their brain injury program. She specializes in collaborating with a team of nurses, therapists, social workers, and neuropsychologists to provide comprehensive rehab care to those with traumatic brain injuries, concussions, brain tumors, intracranial hemorrhages, and ischemic strokes. If you need Dr. Bushi, you are really in big trouble, and you need to hope that people like Dr. Bushi are here, as she is, to help you recover from those kinds of terribly debilitating conditions. She is board certified in what we call a medicine PM&R, physical medicine and rehabilitation. She's also certified in brain injury medicine. And she and I are almost classmates. She finished her fellowship at Rutgers, which is where I got my medical degree. And so that means we're practically related, at least professionally. And she also completed a residency in PM&R. And she's a member of the American Academy of Physical Medicine and Rehabilitation and the Association of Academic Physiatrists. Physiatrists are the physicians who specialize in physical aspects of medical care. So she's here to also help us get some answers to where we are. And Dr. Bushi, I invite you to make your opening comments, please.
Thank you so much, Dr. Amler. Yes, we are somehow related through Rutgers. That's so nice to hear that. I'm really happy to have this opportunity to speak to the community of Westchester. Burke Rehab, where I am now, was key in the efforts to support those in our community that were suffering from COVID. So, you heard the term physiatry used quite a bit, PM&R, rehab. I would say that the one word that really defines what we focus on in this part of our medical world is function. And quality of life really comes after that. So ever since, we've been in this pandemic, we've had patients come through here in our acute rehab facility to work on function, on strengthening, on being able to get back to regular life. And what's really interesting and what I'm hoping to add to the discussion here is really what we're seeing just come up in terms of those who are suffering with symptoms and sequelae of COVID that are beyond just the acute illness. It's been exciting to see the advances we've made with the vaccinations, and hopefully we move forward, as everyone has said, in terms of reducing the cases. But we are seeing now also those that are suffering from symptoms beyond just that acute illness. And so I'm hoping to address that, and especially as it affects those of you who are considering what return to work for your employees that are suffering from COVID or long COVID, as some of you may have heard, or the long haulers, what that would look like, as that's what I'm currently practicing and seeing now, in addition to the brain injury that I do. Thank you.
Outstanding. And for Dr. Torres, a question that has come up is many employees have children, and with COVID vaccines soon becoming eligible, they will have to make that decision on whether or not to get their children vaccinated. As someone with your background and experience, what would you tell them?
Well, from my clinical background, it's clear. I think vaccination is safe and it's effective. Dr. Amler, Sherlita Amler, showed us the statistics earlier and the dramatic rise and fall after we were able to vaccinate a large portion of Westchester County, and we've been so successful, and our government officials and healthcare workers have been a great part of that. So from the clinical standpoint, I would get my children vaccinated. From a personal standpoint, I'm also a father. I have a 12-year-old, and this summer, on her 12th birthday, July 7th, we walked into CVS and got her vaccinated. So she's fully vaccinated. And I have two younger daughters who are eagerly waiting to join her sister to be vaccinated and to get on with our lives and to try to close that chapter on COVID that Dr. Amler had said earlier.
Thanks for that answer. Very succinct and put to the point. And it sounds that you are that your family is in good shape. So we're very happy for you and for all other Westchester and New York families that are weathering this crisis. Dr. Sherlita Amler, do you have anything to add in terms of what you would tell parents?
I would just say, if you have concerns that haven't been addressed, a very good resource would be your pediatrician. And I'm sure they would be happy to have that conversation. Not all pediatric practices may be able to offer the vaccine because unfortunately it does require extreme low temperature to maintain the vaccine. But I'm sure that even if they aren't giving it, they would be more than happy to have the conversation around what the benefits are. But let's just remember that children get vaccines all the time for a variety of infectious diseases. And this is just one more.
Appreciate those answers. And I'd like to move on to Dr. Bushi with a new question. Let's face it, we've heard lots of our friends and neighbors say, okay, if I get COVID, it's like the flu, I'll be uncomfortable for a few days, and then I'll be fine. And I think most of us in today's world kind of walk around feeling, number one, I'll never get sick. Number two, if I do get sick, it won't be so bad. Number three, if it's bad, they'll fix me and everything will be okay. Well, it's that number three, Dr. Bushi, that I think many people kind of gloss over, and they don't really think about the longer term consequences of an essentially unknown infection. So what would be your take in telling people about the potential damage of what is sometimes called long COVID, and what should employers be aware of in terms of long COVID? Thank you.
Absolutely. Thank you for the opportunity again. So I'm sure many of you have heard the New York Times did a piece on it. Many of the media outlets have been covering what they term as long COVID. Long haulers is another term that's been used for folks who have a variety of symptoms related to COVID, but on a prolonged period of time. So typically what we're seeing is that the symptoms, which may include anything from fatigue, breathlessness, difficulty in terms of mobility, muscle weakness, pain, joint pain. And this constellation of symptoms, as you can imagine, really impacts function and ability to participate in daily activities of life, that sometimes they can actually prolong up to 4 weeks. And that's, although there's been some debate, that has been the number that's been sort of consistent. So we're talking about symptoms that are out to about a month after the illness has resolved, is really what is being called long COVID. And if we're looking at statistics, there's been some reports of about 1 in 5 of the people, 1 in 5 of the people that have, had this quote unquote flu-like symptoms or, whatever kind of, mild to moderate and severe symptoms. So that statistic is sort of encompasses all severities of the initial illness. And so even those that have the mild symptoms, unfortunately, are finding that a month later are still suffering with some of these symptoms. And if I can just, pull out one other statistic, there was a research collaborative that surveyed some of these folks. And actually what they surveyed is just people that have had COVID. They found, of course, that those that took the survey, about 96% had long COVID. And out of that percentage, almost half had to reduce their work. And I'll say that again, about half actually had to reduce the amount of work that they're doing. And about 1 in 5, so 20% or so, were not able to return to work. So this is clearly having a huge impact on people's quality of life and on the ability for our society to function, if so many people are not able to get back to work because of these symptoms. Thankfully, here at Berk, we have quite a few resources to help with that, and I'm happy to discuss that, later in the panel discussion.
That's great. So I want to reflect on what you said, put on my M.B.A. hat for just a moment, which I don't wear very often, but think about this. How many, those of you who are watching, how many of you are in a business where you could easily accommodate half of your workforce being able to reduce their workload, if I am quoting you correctly, Dr. Bushi, and another substantial proportion not being able to resume work for a substantial amount of time? How many could really sustain that and continue in your current business model without having to make some very important changes in the way you distribute the workload? There's no answer to that, except that we know this would be extremely tough. We have 2 questions about vaccine statistics and numbers of doses. And I know we can really get down into the weeds on this. So let me just see if I can summarize these 2 related questions. One is to try to address the percent of unvaccinated individuals admitted to the hospital and the level of comorbidities that they presented. We know, for example, people with the comorbidities, and for the business community, this means people who have other underlying conditions that perhaps predispose them to getting sicker with COVID. What about that in terms of the people being hospitalized? And that could be a health department question, but let me go on to the other part. This person, by the way, both of these were anonymous. I think there should be better reporting of the 2-dose vaccines in order to get a more accurate picture of where we're reaching benchmarks to acquire herd immunity. We're still far behind where we originally wanted to be at 70% fully vaccinated by July 2021. And now we seem to be focusing on the metric that defines it as at least 1 dose. So where are we with that? What can counties do to improve vaccine rollouts, especially in underserved communities? So as moderator, allow me to take a prerogative and begin answering that question and then pass it on to Dr. Sherlita Amler. I would say 2 things. Number 1, we can divide this statistic so many different ways. Which brand of vaccine, how many doses in one age group, doses in another age group, hospitalizations in the different age groups. And then what about the ones in the 12 to 17 age group who only recently became eligible for vaccine. And I would say simply, you could divide this many ways, but look at the enormous change in the picture of COVID over the last 10 months since vaccine became widely available. Remember that Dr. Sherlita's Amler slide not only showed a big reduction in cases, hospitalizations, and deaths, but also saw a massive increase in the percent vaccinated. Remember, all those percents were zero on what she showed November 25th, 2020. 0%, 0%, 0%. And now we're up in the high 90s or mid 80s across the board for any way you slice the pie. Think about that. And my other point is that when a certain percentage has gotten at least one dose, it's true they're not fully vaccinated and the virus could still get them. But remember, once you get one dose, we're no longer counting you as somebody who's going to be vaccine hesitant or opposed to vaccine. You've gotten your dose. You're just waiting your time until it's time for the next dose. So we no longer have to worry about that group of people never getting vaccinated because it's a free country after all. But the fact they got one dose means they will, within a few weeks, get the fully vaccinated. Dr. Sherlita, Amler, anything to add on that?
No, but in talking about availability of vaccines. So in Westchester, we have so much vaccine available. First of all, we have state-run sites such as the County Center and the Yonkers Armory, which are open 7 days a week and take walk-ins. And so, they're great resources for our community. In addition, vaccine is offered by tons of pharmacies. I mean, most of the CVSs and other pharmacies now have gotten areas that are dedicated to vaccinating people and having places for people to wait for their 15 minutes of observation. The health department, what we have done is a number of things. We also have a clinic in White Plains where we do vaccines and a clinic in Yonkers where we provide vaccines. But we have been out in the community. So we've gone to schools and done clinics in a large variety of schools across the county. We've done pop-ups, especially in areas where they're medically underserved. We've worked with our federally funded healthcare centers to make sure that they've had vaccine and been able to provide vaccine in also these very underserved areas. So there's been a real concerted effort. And on top of this, I think the group that is hardest to get to and has the most to be concerned about are people who are homebound. So if for whatever reason, they're not medically able to get up and go to a pharmacy, to go to a state or county run site, or to go to a pop-up, we've actually been providing in-home vaccines for those individuals. And so I think that if you really want a vaccine in Westchester County, it's not that hard to get one.
Can I just add a point here right after that? The issue is not access at this point. There are many modalities in order for a person to walk into, or for a paramedic to go to your home, for those homebound people to get you vaccinated. It's hesitancy. Towards that finish line there, the last 10% or so, 20%, depending on how you slice the numbers, it's going to be education. It's going to be programs such as this one. It's going to be other programs that I have been a part of. It's one-on-one teaching, small group teaching. We did something similar at the hospital prior to the rollout of our vaccination, hence our very quick uptake at the hospital. That's the point we're at now. It's not access to it. It's understanding of it, understanding the safety of it. The 200 million plus doses that have been given. People just need to feel comfortable, and they should.
I totally agree with you. Just today, we've had some calls from people about the proposed 5 to 12-year-olds, and they're asking things like, I've heard this is going to make my children sterile if they get the vaccine, which is totally incorrect. And there's just an awful lot of misinformation out there. So please don't take your medical information from the internet. If you have a question about COVID vaccines, call the health department or call your doctor, call somebody who really has the education and knowledge to answer your question in a very accurate manner. And I mean, I wouldn't ask my my mechanic, you know, to pull my tooth or to prescribe me an antibiotic. So you have to go to a source that is somebody who's trained and knows the information. So if you've got questions, please go to somebody who can really truthfully and with a great deal of education answer your questions.
It really can be agonizing for folks who are trying to make the right decisions for themselves, their families, their children, and to be uncertain about the reliability of the information they get. Maybe it's a condition of the internet age, but I have a feeling that throughout human history, there's always been a cave person in the next cave who's only too willing to tell you a bunch of ideas about what's going on. And this would be true for those of us in the medical field if we're trying to get advice in other parts of knowledge, in other parts of experience and profession. Here's a question from, interesting, everybody this afternoon is anonymous, which is fine. Another anonymous questioner says, I believe the slides reveal the vaccines to be effective. Not sure if we can conclude right now that they are safe. So now we're coming back on this theme of, okay, I understand this could protect me, but what is it going to do to me? Hoping we can prove it, but unfortunately, I don't see the data yet. So Dr. Torres, once again, would you care to field this? And I know there's going to be a number of opinions here. So, but you first.
You know, there's been 200+ million doses that have been provided. The CDC has been following through their vaccine adverse event reporting system signals, and there have been some signals with the J&J vaccine around thrombosis. Again, very small number of cases, serious side effects, but very, very small number, under 100. And the messenger RNA vaccines, the Modernas, the Pfizer, more around myocarditis or pericarditis, which is an inflammation of the heart. And none of those patients who had that side effect died. Very self-limited, meaning it goes away on its own without treatment. And again, very small number of side effects, under 1,000 of those that are followed by the CDC and confirmed as secondary to vaccination. So if you look at the number of vaccines given out, 200 million plus, and the number of confirmed side effects, serious and less serious, it's a no-brainer to me, and it's something that I wouldn't hesitate giving my 8-year-old, 9-year-old, and 12-year-old.
And we hope that day comes soon, don't we? I'll jump in for a minute. Look, we are still learning about this infection. We're learning about what it can do. We know it can do some serious damage, as Dr. Bushi alluded a little while ago. We know that no vaccine is perfectly safe or perfectly effective, but look at what's happened. Look at the results. Look at the outcome. We have already lost way more than 500,000 people in our own country alone, and way more worldwide. Numbers that are not even fully counted so far. This disease has killed over 700,000 Americans. More than 2,000 people every single day have died of this infection. Think of 6 or 8 wide-body jets crashing every single day with everybody dying on board. This has been a terrible, terrible blow to our population and to our families. Contrast it with the vaccine, which has been so effective, but also so remarkably free of side effects, although side effects have existed. And if you've had a vaccine like I have, and I'm sure the others on the panel, you know that the next day or so, most of us didn't feel great. Some even had some high fevers, some shaking chills, maybe even for several days could be sick. but it's a big difference from the death and destruction caused by this virus. So to summarize, the benefits far, far outweigh the risks. Dr. Bushi, anything further you'd say on this?
As you said, Dr. Amler, I just wanted to add that, I think when we're weighing risks and benefits, I completely agree that what we know so far, and it's true that we're continuing to learn, as you said, and that's certainly something that we realize in the medical community, but what we know so far really points to very mild side effects at a very low rate. And I just wanted to say again, in addition to the statistics of death, if I can just speak to the lack of function that comes from even a mild illness that we're seeing in our clinic and that we see in our rehab center, I can only, plead with the general public to really consider the vaccines as a source of protection. Thank you.
Thank you. Dr. Sherlita Amler?
I think it's been well said. I mean, I have people all the time who say to me about influenza, well, I never got my flu shot and I haven't died yet. You only get one chance to die. And, if you don't do something and you die, there's no undoing it. There's no going back and saying, wait a minute, I changed my mind and I want to do that. So we really have to remember and look at the statistics that we showed. The number of hospitalizations and death aren't just a little bit less, they're hugely less with vaccinations. So to me, it's just a no-brainer. And I see this as the only way that we get out of COVID is by getting the vaccinations, getting our population safe, and being able to go back to normal life, which is what I think we all want.
And I would simply summarize the whole group here by saying we should all remember that unless you are vaccinated against a particular infection or disease, you remain susceptible to that infection or disease indefinitely. So you will always be susceptible going forward in time until and unless you get that vaccine. I want to switch over again back to get into the business side of things, because we've really been delving into virology and vaccinology and immunology. Let's get back to businessology. And a great question, which I'll pitch to Dr. Torres. What should employers consider when deciding when to bring their employees back to the office?
I think you have to look at the penetration of COVID infections at the moment. Right now, we have a COVID infection rate in Westchester County of less than 1%, I believe. You have to look at the penetration of vaccination in the county, and Dr. Amler had provided those statistics there, and they're fantastic. Those are the big nuggets that you have to think about, and you have to talk about vaccination with your employees, because that's the number one way to prevent infection. Okay, it's the number one way to prevent infection. Vaccinate, 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 whether it's mandated or not. You still need to talk about it and hear their concerns and address them appropriately. And then here at the hospital, we continue to wear masks. I'm in my office all by myself, and so I'm not wearing a mask, but every day we're walking around with masks. And although we don't like it, it's the right thing to do, because we still do have unvaccinated individuals who are putting themselves at risk. And we have vaccinated individuals who are in need of a booster or in need of an additional dose because they are immune compromised. And so if we don't wear a mask, we can also put them at risk because their level of antibody production is less than others. So to me, it's about thinking about what the public health environment looks like around vaccination and infection rate. It's also about talking about vaccinations with your staff and your employees. It's about utilizing of masks because they do work. And then you have to think about air circulation in your place of business, air filters, HEPA filters. You can think about distancing as well. We do all these things at the hospital. They do them in New York City schools. It's something that they promote. And so all things to consider.
Very useful advice, Dr. Torres. Thank you. Dr. Bushi, when patients are coming to you with problems related to long haul or long COVID, what is your follow-up recommendation, generally speaking, in terms of should they go ahead and get vaccinated now if they haven't been? Should they get that second dose if they only had one? If they were unfortunate enough to develop COVID and long haul after 2 doses, although I've not personally heard of that, would you recommend a 3rd dose or booster?
Yeah, I don't think there's really data that shows that the long COVID symptoms are related to the vaccine. So I just want to make that clear. Really, the literature and the data is ascribing these symptoms after an actual acute illness. And typically my clinic visits consist of evaluating what the patient is able to do. So it's about I deal with a lot of statistics, but just so a little bit over a half tend to have fatigue as the main symptom. And fatigue, as you can imagine, really affects how much you can do in your workday. And so based on how much fatigue they're having and what the triggers are, typically I will create a return to work program. And what I would encourage for those on the call here who are involved in bringing workers back who are suffering with long COVID or long haul is to participate in that process. And really sometimes what we find helpful, even as physicians, is to call over to the specific employer because every work setting has a different set of expectations. So it's a collaborative effort. The other thing that I find helpful is having therapy on board. So what we're seeing is that actually physical therapy it is actually improving some of those cognitive symptoms, as well as the physical symptoms that makes people more functional to be able to be productive in their workday. So, those are sort of the resources that I'm providing my patients.
Thank you. I believe we have time for one more question. And I'll throw this up first to Dr. Sherlita Amler, again from an anonymous attendee. What about the new antiviral drug from Merck? How does that change the calculation of risk for populations? I always save the best questions, for the easiest questions for you. So go right ahead, jump right in.
Well, I might have to turn this one to Dr. Torres because I don't think that I'm the expert on this area. I don't know. I always think it's better to prevent disease than to treat disease. And so that is really the basis of public health is, know your blood pressure, know values, your blood sugar values, your cholesterol values, and try to prevent heart disease, try to prevent strokes. So I'm of the mindset that it's always better to prevent COVID than it is to try to treat COVID. But I'm going to turn the rest of that answer, I think, over to Dr. Torres and see what he thinks.
That's a challenge, Dr. Torres. Go for it.
Yeah, I haven't read all the literature yet on it. I know the drug class in and of itself can be somewhat controversial. So if you're talking about safety, the study was done on, I think, only 2,000 or 3,000 patients, which showed a significant improvement in hospitalization and disease course. So that is encouraging. But I think the jury is still out on the safety profile of this medication. I'd like to see more studies done if I'm going to consider it a game changer. We'll have to wait and see.
And Dr. Bushi will give you the final word. I know there's not going to be a pill for some time to prevent long haul COVID, but do you have any thoughts on the possible usefulness of this medication given early enough in preventing the kind of cases that you have to see?
Yeah, I mean, I'll just really echo what was said before, which is to say that it's always encouraging to see new treatments come out to prevent the kinds of things I'm seeing. But I really want to go back to what Dr. Sherlita Amler said, which is prevention is key. So, let's get vaccinated and that way I don't have to deal with as many of these cases. Yeah, thank you.
Thank you all very much. So looking over this, we had prevention, treatment, and rehabilitation all represented on the very same webinar. So turning it back to Amy Allen for the concluding remarks. Thank you all.
Thank you, Dr. Amler. And again, thank you to all of our panelists and speakers. Clearly, there's a wealth of knowledge here. We heard a lot, as Dr. Amler just said, about the benefits of prevention, vaccination. As employers think about what does that mean, I think the medical data is very compelling. Obviously, we have medical professionals on the field. They're not legal HR folks. That I think will be an interesting discussion for a future webinar about how this plays into what legally can be mandated by employers. But I think this is great for setting the stage for how important the medical information is. So I thank you all for that. I also, of course, want to thank our sponsors again, our two event sponsors, C-Clean and Healthy Connections, and our Platinum Healthcare sponsors who support us all year long. As I said, we will certainly be addressing this topic in the future. If your question wasn't answered or you think of additional questions you would like addressed, feel free to email me. My email is pretty easy. It's aallen, A-A-L-L-E-N, @westchester.org. We also will have this webinar will be up on our website, and you can view it on demand. So again, lots to think about. It's changing daily. We're fortunate to have folks at the county, both at the public sector and at our healthcare providers, who really are so knowledgeable. So thank you all, and let's everybody stay healthy. Thank you.
Thank you.
Thank you for participating.
Absolutely. Happy to be
I
here.
think we're no longer live.
I have to drop off, so take care.
Thank